Hello everyone. Welcome to Healthophiliac family. For another video on common health related topics of our day-to-day life. To know all the necessary information on the topic along with how to manage it. Please watch till the end. So let's get started. What are we going to discuss today? One of the important concerns of today's world. And that is hypertension, or increased blood pressure. So let's see, what topics are we going to cover in this video? We will discuss about what is hypertension, what are the risk factors, common symptoms you may see, complications of the condition if left untreated, prevention and management of the condition, treatment protocols and some other lesser-known facts. So without waiting any further, let's get started. What is hypertension, or increased blood pressure? Hypertension, also known as high blood pressure, is a long-term medical condition in which the blood pressure in the blood vessels is persistently elevated. Blood pressure is classified by two measurements: the systolic and diastolic pressures, which are the maximum and minimum pressures respectively. Let's understand, what are the risk factors for the condition? Risk factors can be classified into two groups: modifiable risk factors and non-modifiable risk factors. Let's see, what are the modifiable risk factors? You habituate yourself with unhealthy dietary habits like excess salt consumption, more saturated and trans fat intake, less fruits and vegetables consumption, and other factors like not doing regular physical activity, consuming tobacco and alcohol, and in individuals having overweight or are obese. Non-modifiable risk factors include a family history of hypertension if present, individuals whose age is over 65 years, and presence of coexisting diseases such as diabetes or kidney disease. For knowing about diabetes and everything about it in a summarized way, refer to my previous video on diabetes in a nutshell. Link is given in the description. So, now let's understand, what are common symptoms you may discover? Most of the people having high blood pressure do not show any symptoms. When they do show symptoms, there may be presence of early morning headaches, nosebleeds, irregular heart rhythms, vision changes, buzzing in the ears, nausea, vomiting, anxiety, chest pain and palpitations, etc. What complications can happen if you leave hypertension untreated? Excessively high blood pressure can decrease blood flow and oxygen supply to heart and other organs, leading to chest pain, which is also known as angina, heart attack due to decrease of blood flow and oxygen supply of the heart muscle cells, heart failure, irregular heartbeats, shock leading to multiple organ damage of the body, brain stroke due to less blood and oxygen supply to the brain, kidney failure, etc. When you think you may be having the condition, how will you confirm the diagnosis? Let us see. Different age groups can have different range of normal blood pressure. These values show an average of blood pressure values after measuring and averaging among the masses. Now, as we know about the disease and its complications, it's clear that there should be a way to prevent it. So yes, Let us now understand how you can prevent this condition as much as possible and manage it. Reduce salt intake in your diet to at least less than 5 grams daily. Eat more fruits and vegetables. Do regular physical exercise. Avoid tobacco and alcohol consumption. Limit intake of foods containing high saturated fats and trans fat, for example in fast foods. Avoid taking stress as much as possible. And relax your mind regularly. Check your blood pressure on a regular basis to maintain a proper check on it. Now, if you diagnose yourself with high blood pressure, you should opt for a treatment protocol. Now, what treatment options do you have? Several drug therapies are used to treat hypertension, such as angiotensin-converting enzyme inhibitors, angiotensin II receptors blockers, diuretics, beta blockers, calcium channel blockers, alpha blockers, alpha agonists, renin inhibitors, and combination of more than one medications. Among these, ACE inhibitors, ARBs, renin inhibitors, act on renin-angiotensin-aldosterone system of the body, beta blockers, alpha blockers, alpha agonists, calcium channel blockers, work by acting on blood vessels, heart muscles and receptors of the body. Combination of more than one drugs has proven to be very effective in several cases. Drug therapy should always be started with the consultation of doctor, as different individuals having different health conditions are given different drugs. For example, diuretics are the first-line treatment of hypertension. However, in people having diabetes, ACE inhibitors are given as the first treatment. And also, if one drug doesn't work effectively, other alternative medications are given. And after the treatment starts, one should keep in mind the discipline of taking drugs on time regularly, and follow up regularly. Let us enhance our knowledge a bit about this condition by knowing a few more facts. High blood pressure may be linked to dementia and other problems, such as anxiety, diabetes, chronic kidney disease, etc. Preeclampsia or eclampsia. Preeclampsia happens when a woman who previously had normal blood pressure suddenly develops high blood pressure and protein in her urine, or other problems after 20 weeks of pregnancy. Women who have chronic hypertension can also get preeclampsia. Thank you everyone for watching this video. Hope you all like it and can now have a more or less clear impression of hypertension. If you like this video, then please hit the like button and share it among your friends, relatives, and closed ones, as social awareness has no limits. To get more videos like these, please support by clicking the subscribe button and pressing the bell icon beside it for instant update notification. And henceforth join your own health affiliate family.